Bella Salon and Day Spa, located at 41 West Main Street in Northeast Pennsylvania, proudly supports Chautauqua Sunrise and its volunteers. More information at bellasalonanddayspa.net. Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie. From the Access Chautauqua Studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Chautauqua. We are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week from 9 to 10 a.m. Send events via email or call us live. Check us out on YouTube and Facebook. And now, from the Access Chautauqua Studios, it's Chautauqua Sunrise.
Well, good morning, everybody. I'm Doc Hamels, and a frosty Saturday morning to all of you. Wow, it was like 25 degrees up on the knob in Ripley, but it is the first full week of November out of the way and the beginning of the second week, I guess, since it is the November 9th. How did that happen so quick? Seems like we were just talking about Halloween and getting ready for election season. Poof, gone. And now we're into the holiday season. You know, those commercial folks, they are tricky. They kept coming up with all these ads that weren't exactly holiday ads prior to Halloween, but they were sort of like, you know, getting ready for the holidays kind of a thing without talking about the holidays. They keep stretching that shopping season longer and longer and longer. I don't know why they just don't like advertise year round and be done with it. It's just nuts. Well, anyways, so I want to say, first of all, good morning to all of our viewers. We are live here in Mayville, New York at Access Chautauqua Studios, channel 1301 on Spectrum. We are live and we are streaming live to the world. So good morning, world, wherever you are, if you're watching us. Leave us a note on our Facebook page. Love to hear from you because I do know we do have folks from various parts of the world that watch the show on YouTube from time to time, especially down in Florida and other parts of the United States. Also, of course, everybody, good morning here in Chautauqua County. It's proving to be a nice day already, cold, but it looks like we're going to have a little bit of sunshine. That's really cool. And good afternoon to all of my listeners on WRFA 107.9, Low Power to the People, on Tuesdays at 1 o'clock. So glad you could join us. Got a great show in store for you, and we're going to be learning more about some of the services and the happenings at Westfield Memorial Hospital. So do stay tuned for that. Okay, a few things I want to share with you. Our buddy Steve Gustafson over at JCC wants us to remind you that West Side Story is going on this weekend and next weekend at JCC. And I believe there's a 2 o'clock show tomorrow afternoon. We're going to try to catch that one. Just like I'm doing right now, I'm sharing some information with you of news. Don't forget that you can always give us a call at 716-753-5225, and you can share your story, your anniversary, a happy birthday to someone. If your club or organization has a fundraiser, a spaghetti dinner, chicken and barbecue, whatever, give us a call. We're happy to get it on the air and share it because this show's all about Chautauqua County in the area. I added 716 because now that we're streaming, maybe you're watching this outside of the calling area. So that is our area code, 716. See, Justin, I'm on my A game today. Yeah. All right. So I got a few announcements to share with you because people send us stuff throughout the week. Not too many today, but certainly more than we had last week. We had kind of like a dip, and now we're back up again. And sometimes, I know it's hard to believe, but one day I have 13 pages of announcements. Today we got about 5 because I trimmed off a few things that are down the road. Okay, let's start over in Jamestown with our good friends at Infinity Performing Arts Center there. They want you to know that Infinity is excited to announce their upcoming fall class schedule. In addition to nearly 300 students, that's hard to believe, who are taking private lessons at Infinity, students are offered the opportunity to participate in group classes, workshops, performance events, and a whole lot more. Fall group classes include, now listen to this, there's got to be something here for everybody that we know, young folks. Art classes, steel drum exploration, vocal and dance ensemble, Instill, which is a leadership program, sewing, beginning and advanced music theory classes, intermediate art, moving and grooving. That sounds like fun. Vocal ensemble, let's dance, advanced art, lyrical modern dance, bar and exploration. I think that must be guitar because that's a bar chord. Performance, workshop class, video crew, and seasonal art. Now, I saw sewing there. One of the things that I was fortunate to have was a grandmother, a Sicilian grandmother, who taught me not only how to cook, she taught me how to sew, and that was a life skill that I've used all my life. So if you have a yen for sewing or want to know more about it, that could be a lot of fun. Infinity will also be offering a guitar-themed Fix-It workshop with a local luthier, my buddy, Jim Holler. I bought my guitar from him and my mandolin on Monday, November 18th from 4 to 5 p.m. And a looping pedal workshop with Kyle Gustafson on December 3rd. For more information, including dates and times of classes and ages, please visit Infinity's website. And this is all one word, infinityperformingarts.org, or simply give them a call at 664-0991. And they also invite you to join them for a new student orientation on Thursday, November 21. Students that are new or may be interested can learn more about the program and sign up for lessons. It's a great opportunity. I've been there when they've done one of their orientations, and the kids can go check out different aspects of the program, and it's just a lot of fun. Also, footnote, we're going to have some Infinity students come here in December for the holidays and put on their annual, this will be their 3rd annual, I believe, holiday concert with us. A little bit of a program here. Okay, coming up this Monday evening, Sherman, New York. You are invited to join the Olive Lodge, Freedom Accepted Masons, for their fall chicken and biscuit dinner. They're saying this is comfort food at its finest. It's going to be at Monday, November 11th from 4 p.m. till sold out. It's at 197 Park Street in Sherman, New York at the Masonic Lodge. It's $10 per adult, including dessert. Children under 12 years old, $5. Serve-to-go seating available. And if you are interested or have questions, give Doug Molson a call at 223-0326 or Ron Vettenberg at 640-6161. Again, this Monday, November 11th, Masonic Chicken and Biscuit Dinner in Sherman. All right, the Chamber of Commerce always shares all kinds of good things with us. And coming up is on November 13th, that's real quick this week, the 6th Annual Technology and Manufacturing Expo will be held Wednesday, November 13th at the Manufacturing Technology Institute, also known as MTI, at Jamestown Community College. This event is a great opportunity to showcase your manufacturing company, be exposed to technologies, network with other manufacturers in the region, build your supply chain, and identify potential new customers. And it's being sponsored by a whole bunch of folks. And the expo will run from 10 a.m. to 4 p.m. Lunch will be provided at noon. There's no cost to attend, but prior registration certainly is appreciated. as you can well imagine. If you have questions or you want more information, give me a call at 366-6200 or 484-1101. This came in, and I'm going to give my best shot on this. There's going to be something called the United Community Christmas, and this is working with the United Way of Northern Chautauqua County, and they're saying this is, they'd like you to join for the second annual United Community Christmas event. The best tree, as described on their Facebook voters will vote, and they're going to choose a winner, and the prize money is split with a United Way partner and the United Way of Northern Chautauqua County. They're seeking businesses to participate, decorate a tree, have some social media fun, and help a family in need this holiday season. So I would suggest that you either check with the Chamber of Commerce of Chautauqua County or the United Way of Northern Chautauqua County if you're interested. Okay, also, they want you to know they would like you to help gather up new and gently used kids' coats. Visit one of the many local stores to find a new coat or clean out the old attic, basement, and closet to help them ensure that every child who needs to be warm this winter will be. Over 200 coats have already been distributed to the community this winter season, and we're just getting started, for goodness sakes. Through the joint efforts of the United, let me get this right here, United Way of Northern Chautauqua County. They give me all these initials, UWNCC, so I got to go back and figure out which ones are worse. Which? The resource centers involved, the East Main Laundry, the Salvation Army, and so on. Winter is just beginning as we're still collecting in the hopes of crossing every name off the very long list of coats. I can't believe that kids don't have coats these days. I mean, gosh. So anyways, so check in with United Way and or those organizations listed, and let's make sure everybody has a nice warm winter. Okay, Christmas in the Village. Let's go to Westfield. Westfield is having a party, it says here. Plans are being made to celebrate Christmas in the Village, November 22, 23, and 24. Please join them and discover the timeline on their Facebook page. If you go to the Westfield Barcelona Chamber of Commerce, they've got all the information on there. And if you have any questions, give Sue Poster a call. Sue's head of the Chamber of Commerce there, 248-830-6058, 248-830-6058. That's a phone that she's used. I think it's from Michigan. Anyways, it's really a lot of fun. They do have a lot of folks dressed up in period dress from Tiny Tim's era there, Bob Cratchit days. And so they have a great time. And usually there's what they call that, horse-drawn buggy rides and hot toddies and all kinds of fun things. Usually the museum there at the McClure gets involved too. Okay, let's go back to Jamestown to my friend Ken Harley with his Rolling Hills Radio Show, November 25th at Shawbucks, coming back again this month. The Rolling Hills Radio will present Ramsey's Sisters and folk singer-writer Garnet Rogers for episode 92. Gosh, it doesn't seem possible. They've been doing this for so long. Okay, let me tell you a little about the folks. Sisters Mary and Susan Ramsey are both classically trained in viola and violin. Their appearance on Rolling Hills Radio is a rare opportunity to see them playing and singing together. Let's see if you remember who this person is. Mary Ramsey. Does that ring a bell, anybody in Jamestown? Mary has worked with the Erie Philharmonic, the Fresno Philharmonic, the Santa Cruz Symphony, and the Monterey Symphony in California. She's also the front person, singer, and viola player for the 10,000 Maniacs. Yeah, right here in Jamestown. With 10,000 Maniacs founding member John Lombardo, she is the folk duo of John and Mary. So Mary's a busy, busy lady. Okay, her sister Susan studied viola and violin at Smith College. She's the director of the Foxcroft Academy string program, as well as playing viola and violin with David Millett. Ooh, now I know some of his work. Good stuff. Okay, now Garnet Rogers began his professional music career as a full-time working musician with his older brother Stan, a noted and well-respected folk musician of his time and beyond. Together they formed what has come to be accepted as one of the most influential, I gotta say that slowly, influential acts in North America in the folk music genre. After Stan's tragic 1983 death in a tragic airplane accident, Garnet embarked on his own solo career. Hailed by the Boston Globe as a charismatic performer and singer, Garnett is a man with a powerful physical presence, close to 6.5 feet tall, with a voice to match. With his smooth, dark baritone. Washington Post says his incredible range and thoughtful, dramatic phrasing, Garnett is widely considered by fans and critics alike to be one of the finest singers anywhere. Sounds great. His music, like the music himself and the man, is literate, passionate, highly sensitive, and deeply purposeful. Cinematic in detail, his songs give expression to the unspoken vocabulary of the heart. Whoever wrote that, I'd like to have them describe me sometime. Wow. Host Ken Harley says of the Ramsey sisters, he's been prepared in the presence of these two making music together, and I can tell you that they personify the old saw that there is a musical simpatico between siblings that is natural and effortlessly beautiful. Okay, you got to remember that this is at Shawbucks in Jamestown. The doors open at 5:30 for their rolling happy hour. And there's food and drink available until 6:15. The show starts at 6:30. They do have a 10-minute intermission where you can get up, stretch, and get something to drink. And of course, afterwards, there's the meet and greet so you can meet the performers. You can get tickets by calling 294-0416. You can go to their online site, rollинghillsradio.org/tickets. And get your tickets there, and you can also buy them at the door. Only $15. Sounds like a great night. Okay, two more quick things, and then we're going to take a little breather here. Small Business Saturday. We've been talking about this every year. The Chamber of Commerce members remind you that this is the time to sign up and to be listed in the Chamber's annual Small Business Saturday promotions. The annual event is promoted nationally by American Express and is celebrating its 10th year. Once again, this year, Chautauqua County Chamber of Commerce has signed on as a neighborhood champion for Small Business Saturday, which is November 30th, the Saturday after Thanksgiving. Okay, without going into great detail, generally speaking, they put together a program where you list your business and you get some ads and so forth. We're going to talk about it here more and more. Some of my underwriters in the beginning of the show, Meters, Bella Salon, those are small businesses. Even for owning a place, I guess you could consider them a small business. These are organizations that depend on foot traffic that comes through the door. So we have lots of great small shops here in Chautauqua County and the surrounding area. So let's keep that in mind. When you go shopping, you may not always have to go online to buy things. You could just go on down and visit these folks and get all the things you need for the holiday season or anytime. November 30th, remember, Small Business Saturday. And finally, Giving Tuesday is on December 3rd this year, and we'll mention it from time to time. And what is it? It's a global 24-hour fundraising blitz that raised approximately $400 million in 2018 worldwide. United Way of Northern Chautauqua County will participate again this year along with other local organizations. Follow them on Facebook, Twitter, and Instagram to hear about all the work they're doing right here in Northern Chautauqua County and throughout the region. And let's see. So Giving Tuesday is coming up December 3rd, and they're certainly not the only organization that would benefit from your contribution on that day. Okay, that's it for my announcements. We're going to take a little breather, and we're going to be right back, so stay tuned. Thank you.
I'm Anne. I'm a scientist.
Recycling takes a team.
Why don't you let me and me help you out?
Everyone plays a part. Don't trash
I love taking stuff apart and building new things out of it.
what could be treasure.
Pal's my most advanced android. This is awesome. You haven't seen anything yet.
Give your cardboard box another life. Recycle.
All year long, I collect the various boxes that come into our house because right around December 15th, my wife says, we got any boxes I can start using for wrapping presents? I have a whole slew of them. I don't throw them away. They go into the basement, they pile them to the ceiling, and we're ready for the following year. My mom was a great recycler. When we cleaned out their attic after they passed away, we found boxes full of boxes. She never threw out a box, I don't think. Never saw a stranger there. All right, enough on that. Want to welcome to the show today someone that I've known for quite a long time, on and off over the years, it seems. The president of Westfield Memorial Hospital, Karen Surkala. Good morning, Karen.
Good morning. Thanks for having me today, Doc.
Absolutely, and I know you came a bit of a way to get here today from Erie, right?
Yes.
So, got much snow down there?
Not too much. Actually, I think there's more snow up this way than we have at the lakefront right now.
Last year, I think Erie got a whole lot more snow than we did here, so maybe it's going to switch back this year.
I hope
You
so.
hope, but you still got to come through here, though.
You're right. Indeed, I do.
Okay, Karen, we've had a few folks over the last month or two from the medical world. We had Brenda Burdick, who talked about lymphedema and how to treat breast cancer when we had Breast Cancer Awareness Month in October. We had Dr. Chris Clark, who is the president of St. Vincent's. That was his inaugural visit with us, and he actually liked it here, I believe. He kind of gave me a good review, and I think we're going to have him back in the future to talk about what's going on at St. Vincent's. And of course, you are connected to all that, and we'll get to that in a minute. So, you've been back as president, but you had a different title once upon a time.
Sure. So in 2008 through 2011, I was here, had the pleasure to be here at Westfield Memorial Hospital as the Vice President of Operations, and really worked with the hospital and the community to save Westfield at that point.
That was during the Scary Burger Commission days, right?
Yes, absolutely. So I'm delighted to be back and in this community and to help continue not only to support healthcare in the rural community, but hopefully to grow it. I think there's a great opportunity at Westfield today to expand the services we offer, not only here in the community, but also with our partner of St. Vincent's and Allegheny Health Network.
So you've been gone for 8 years?
Yes.
Wow.
Time flies.
So, I was going through my mind who had been in your chair there since you left, and I guess, there's been like 3 people, I think.
3 people through, yes.
Wow. So, Karen, tell us a little bit about yourself and where you're from and all that good stuff.
Sure. So I'm originally from Erie, born and raised, and I have more years of healthcare experience than I care to admit, but been working in the healthcare industry my entire career, about 30 years, and have had the luxury to work at both big and small organizations, with Westfield being one of the smaller organizations that I've worked with. I had a number of roles at St. Vincent's: planning, marketing, recruiting, communications, operations. Then I left there after my time at Westfield and spent about 4 years at the Cleveland Clinic.
Wow.
And I was working in strategy and planning and operational execution. So, that was really a great experience for me to kind of broaden my horizons and understand how large systems work. And then I was very fortunate to have the opportunity to come back here and, again, be part of a large system of Allegheny Health Network, but really on a small scale focused here in the Westfield, northern Chautauqua area.
Well, I know from people in the community, they were happy that you came back.
Thank you.
And so I wish you good luck in that endeavor. How does someone get involved? I mean, you're not a doctor, you're not a nurse, so I think people don't realize that there's a whole track of professional endeavors that someone can pursue within the medical world that aren't those. So how did you get involved?
So it was kind of a fluke how I got involved. While I was going to college, I was looking for a part-time job, like all kids, trying to make ends meet, and I started working at St. Vincent's Health Center. I actually started working in the cafeteria at St. Vincent's.
What were you doing there?
I was a cashier in their cafeteria for about 2 years.
You started as a cashier, and now you're the
did.
president of Westfield Memorial Hospital.
I did indeed, yes.
Great success story there.
So I worked full-time, went to school full-time, and then just kept progressing up through the ranks. But there is a whole track, even kids who are looking for careers, they have master's degrees in healthcare administration. So there's a lot of opportunity to work on the operational side of healthcare. And what I like about not being a clinician is sometimes it prompts me to ask a question that's not, because I don't have a license, I dig a little deeper. I make people explain to me why we can't do it or why we should do it in a particular way. So I think I bring a unique skill set given that I'm not a clinician.
That's what I do every week here on the show. I look through the eyes of a 6-year-old and ask questions that I don't understand. So I get that. So I don't think people realize that you need somebody to corral the cats and keep the lights on, and keep things moving. So that's an art in of itself. So you've been doing this for 30 years.
Yes, I have.
I wouldn't have guessed that. So congratulations. You don't look like you've been through 30 years.
Well, thank you. Some days I feel like it.
Well,
but,
I bet we all had those where the hair's standing straight up.
Yes.
Okay. Just like every other field, education, commerce, manufacturing, the medical field, to me, just from my conversations with people here on the show and in the community, it's constantly evolving. It's constantly being morphed into something different and coming in with new strategies. So at this point in time, Karen, from your vantage point, what's the world of medicine looking like for folks? I mean, it used to be the old country doctor. Those days are sort of gone and they're sort of back. It's sort of both.
Sure, and I think, there's this thing, and we have it in all fields, disruptive innovation. And I think in healthcare, we're seeing it come to pass even faster. There are drugs, there are devices that are being developed every day that dramatically change the way we care for patients. The other thing that I see is physicians, nurses, all kinds of clinicians becoming highly specialized. It used to be a general surgeon took care of everything from, sort of the neck down to the hips. Now that we have physicians who just work on the hepatobiliary system. We have physicians who just do breast cancer surgery. So it's becoming more highly specialized, but as it becomes more specialized, we have to be careful and have our eye on that frontier of where is that disruption coming. Because sometimes, we used to do a procedure and now there's a pill we can take that requires that we no longer have that procedure. So we have to always be thinking about what's on the forefront and really putting the patient at the forefront to say, what does the patient really need? What's the right thing to do for the patient?
I just drew a little man on my paper here. And what that is to me resembles and is reminding me of the holistic approach. Because I'm thinking about the old story about, the 3 blind men. They're feeling various parts of the elephant and they don't know what the animal is. So I could easily see that unless there's a team approach to a patient, one doctor could be prescribing something for arthritis that might be affecting something neurological, that could be affecting their diet or whatever. So how does that all work when you're running a hospital?
So we do try to always take a multidisciplinary approach to care, whether we bring in, X-ray, lab, physical therapy, other specialists. One of the other innovations that went live in Westfield about 1.5 years ago was the Epic electronic medical record. And the benefit of that medical record is the fact that all of my information is in there. So once a provider, if I come into the emergency room at Westfield and the provider puts all of my information in and I end up getting transferred down to St. Vincent's, they have a complete record of not only what happened to me at Westfield, but all of my allergies and previous surgeries and any health information that was garnered here in Westfield they have access to. The other benefit is there's another component of Epic called Epic Connect that if I had care anywhere at another Epic site, they also have the ability to bring that record in. Wow. So the multidisciplinary team approach is very, very important, but also having that electronic component with my historical medical record is very helpful as well to ensure we're doing the right thing for the patient.
All right, now people that are listening and watching right now, they're probably saying, oh, I just hate going to the hospital or the doctor because I got to fill out the same, my words, not theirs, stupid, redundant forms constantly. Does that eliminate a lot of that?
It's probably helped not so much on the patient side, but it has significantly helped on the the provider side. So it's
Right.
less paperwork for our clinicians.
So we still have to fill out the forms.
You still have to fill out the forms, and we're likely going to ask you for your information every time you come in, because so many times these days people's insurance change, we're coming up on that season where a lot of insurances will change going into January 1, and we want to make sure we bill appropriately for your benefit.
Okay.
So that's why
So
we
there's
do
a reason
that.
for that. All
There
right.
is.
All right, folks, we still got to do the paperwork. A question just came through the system, through my earpiece. If a hospital, a doctor is not part of Epic, can they ever get those records, or what happens?
Yes, absolutely. Your records are always available, and patients can come into the hospital and sign to have their records released.
Okay.
If someone was transferred to another facility that wasn't an Epic facility, they sign a release, they can call the hospital and we transfer those records over immediately.
Oh, that was a great question. Thank you, caller. All right, very good. So when Dr. Clark was here, I alluded to the analogy of the Russian nesting dolls, where Westfield Memorial is like the middle doll, and then everything comes around at St. Vincent's, and then Allegheny Health Network down in Pittsburgh, and so forth. So what you're saying with Epic, then if I started at the hospital, those records are a portal that goes straight through that system?
Yes. Yes,
Okay.
so if you had to go to Allegheny General in Pittsburgh, they would have all of your records there before you arrived.
Can a patient go into that system and look at their records?
So there is a component called MyChart of Epic, and patients who have a primary care physician that are part of the Allegheny Health Network have access to MyChart, which allows you to see portions of your electronic medical record.
Okay, because I think sometimes people want to go back and say, I don't remember when I had my last colonoscopy here. I don't remember what medicine did I take or whatever, so that's good to know. I think that my sense is that the medical world is trying to empower people to be more advocates for themselves and be more knowledgeable, so that kind of fits in there.
It does fit, and even in there it will tell you when your last study was, if you have an upcoming appointment, the results. You actually can get your results of your studies quicker because it will populate as soon as the physician reads it and puts it in MyChart. It will ping my phone to tell me I have a new message from my physician.
Very cool. Okay. You mentioned the Burger Commission days back about, about 11 years ago. And so how did it all end up for Westfield Memorial Hospital, in summary?
So we were very lucky to be able to maintain a 4-bed hospital here in Westfield. We worked very closely with the state as well as officials in Buffalo and across Chautauqua County to help continue to keep healthcare local here in the community, because we believed we live in such a rural community here. We have the Amish that we care for, a lot of elderly folks, so it's very important that we maintain services here. So we were able to keep, a 24/7 emergency department that's staffed with board-certified emergency medicine physicians. We have a outpatient operating room that allows us to do general surgery cases, colonoscopies, orthopedic surgery, and ophthalmology. So we were really able to keep a full functioning hospital. Now that we're moving forward past that phase of time with the hospital, we really want to start to look at what can we do to expand services. I think for a period of time we were asked to maintain a certain level of services, but now through our partnership with Allegheny Health Network, St. Vincent's, and the support of the Westfield community, we'd like to really start looking at how can we grow and expand the services that are available here.
When you said 4-bed hospital, I think sometimes that might confuse people. There might be people right now watching and listening saying, you've only got 4 beds in that whole building? What does that mean?
Well, we had to limit the number of beds that we had in our hospital, but we are able to keep inpatients, and we've been working to keep more and more inpatients. So instead of coming into the emergency room and having to be transferred out to St. Vincent's or another facility, we're working to keep you here local, so you don't have to drive to Erie or Buffalo or Pittsburgh. So we're really looking to expand those services and to be able to keep people here who belong in the community, because we're really about the right level of care at the right time in the right setting. And for many people, Westfield is the right setting. There's no need for them to go onto a larger, tertiary facility for advanced care.
Okay. So, again, for those that are listening, that must be a relief to hear that, because I think there was something out in the, let's call it out on the street, urban myth, whatever, that if you went to Westfield, you got transferred automatically. And what a strain that can be on a family. I mean, especially for someone that's elderly, their spouse goes somewhere and they don't have the means to get there, and now they got to call people up and go over here, there, and everywhere. But I'm assuming, obviously, when you say to a tertiary facility, that means a higher level of care, correct?
Yes, it would be a higher level of care, but things like simple pneumonias, some sepsises, cellulitis, there are a number of things that we can keep here, a number of conditions that we can keep here in Westfield, and especially at this time of the year as we get into the snow season and it gets dark earlier, people don't want to be driving on the highway outside of this community. So we're really working with the EMS providers, our local physicians, and specialists at St. Vincent's to find unique and different ways to keep patients here rather than having to transfer them out.
Well, Westfield Memorial Hospital is in Westfield, but what do you consider the catchment area or your service area?
So I believe we service people all the way up to Chautauqua Institution. If we're heading south, out to the Ripley, Pennsylvania border, and then over through Brockton and Portland. We see patients from all of those areas on a routine basis. And while the Chautauqua Institution is open, we see hundreds of patients from the institution every year, both in our clinic that's on site at the institution as well as in our emergency room and other ancillary services at the hospital.
We're streaming now. We're on the radio now. So someone from Jamestown, Frewsburg, from Ohio, from Pennsylvania, wherever, Buffalo, can they come to Westfield?
Absolutely, absolutely. We are a freestanding hospital, just like any other hospital in the county or across New York State. We're a fully functioning hospital.
And I'm not going to go into the insurance story, but obviously same insurances that you can use anywhere else are available to be used at Westfield?
Yes, absolutely.
Okay. Folks, you're watching Chautauqua Sunrise. I'm Doc Hamels, and my guest today is the president of Westfield Memorial Hospital, Karen Surkala. And if you have a question or a comment or, again, any announcement, give us a call at 716-753-5225. Okay? Because this is an opportunity to find out more information about a great hospital, which is just 8 miles from here, just down the road from where we are in Mayville. Okay, so you mentioned some new features. So I'm going to ask you a question. So you were gone for, we said, about 8 years. So what's new for you now that you came back? Like, you probably say, "Wow, I didn't know that was here," or "Wow, I wish I had thought of that," or whatever. Because you've had some folks that have come before you now and after you. It's kind of weird to talk about that. Came after you and before you. That have done some innovation. So what's new at Westfield for you?
So I think the thing that struck me the most is the investment in the physical plant and in the equipment and technology that's available at Westfield. I was pleasantly surprised to see all of the clinical providers. Many of the clinical providers that I worked with when I was here 10 years ago are still here providing outstanding care. But when I look at the technology, the brand new emergency room, a 64 CT slice scanner, available both for our emergency room patients and to do outpatient diagnostic services. There's a continual investment in Westfield by our corporate partner to ensure that we have access to the best technology to provide the right care at the right time to the patient.
64 slice CT sounds scary. So what do you mean by 64 slice? I mean, Justin's looking at me, I'm looking at him, when I go, we're not talking about cutting anything, are we?
No. And remember, I'm not clinical, so
me either.
My definition will be less than what you'd hear from a physician provider. But it actually, CT slices used to come in 8. Okay. And then they went to 32. Now they're at 64 and even on to 128. I'm assuming these are thinner slices? And they're thinner slices. You actually get a better image. Okay. You get a clear image at a thinner view, so we can detect things faster. And one of the things that we are able to detect better with the 64 slice CT is lung nodules that could potentially be lung cancer. In an 8 slice CT or even a 32, you wouldn't be able to get a granular enough image to see that nodule. But now with a 64 slice CT scanner, you can get a better image and a more defined view of that.
Now, I heard something, and I can't remember if this is true or not, so true or false. I told you I was going to ask you true or false questions today. The CT scanner that you have at Westfield is the highest level of technology in the county.
That is true.
Oh.
Yes.
Okay.
For CT imaging.
Really? Mm-hmm. And you mentioned before the show that this month is a special month.
Yes, it's National Lung Cancer Month.
So this is perfect to have that new machine.
So it's perfect to have the new machine, and Westfield is one of the only facilities in the county that has the ability to do an advanced lung screening. And those lung screenings are typically for patients between the ages of 55 and 80 who aren't showing signs of lung cancer but have smoked a pack a day of cigarettes for more than 30 years or 2 packs a day for between 15 and 30 years. And we can actually do a lung screening to identify if there are any nodules. In many cases, they may find a nodule and they may not take any action on it, but it's more of surveillance to make sure if that nodule changes in any way, we're aware of it and we take action quickly to deal with it.
So this is a new service?
It is a new service. We started it in September, and I'm pleased to say that we've seen over 80 patients, I think, now already be screened in our program.
So let me run that back then. So this has to be somebody that fits in this particular category to get this, you said low dose?
It's a low dose CT scan.
What do you mean low dose? I mean, do you take medicine for this?
No, it gives you the smallest possible dose of radiation.
Okay, all right.
So it's very safe.
All right, and with the 64 slicer thingy, then you can pick up, you said nodules?
Yes, which
What's
one
a
could
nodule?
be. It's a small mass, and some people have nodules in their lung that are completely benign.
Okay.
Others will have nodules that at some point could become cancerous.
And the concern there is that those things break off, right? And travel throughout your system and
They
raise
can.
heck.
So it's important to know that they're there and watch them. Typically, if we find something and we decide it's not actionable today, they'll watch it every 6 months. You'll have another scan for a period of time until they decide, 1, nothing's going to happen with it, or 2, we need to go in and take a look at it or possibly remove it.
Insurance covers this?
Yes.
Okay.
And actually, there's a special number and a screening program through Allegheny Health Network. So if people are interested in the service, they can call us at the hospital. We'll give you a 1-800 number, and they actually set it up to ensure that it's a covered service.
How much easier can that be? Do we have a number for the hospital they can call?
We do. It's 716-326-4921.
326-4921. Okay. I'm intrigued about this because, unfortunately, I lost a very good friend, a childhood friend, to lung cancer, and I wonder if he had this early detection system. Here's the scenario. His parents smoked, both of them, like chimneys. We used to go in the house when we were kids, and the whole house was just blue with smoke. And then he smoked, and I would suspect that he obviously would be an easy candidate, and ended up dying of lung cancer because it spread through his body, into his brain, and all his organs in that. It seemed like a horrible way to go. And that this would be really good for folks that perhaps have worked in industrial settings too?
Absolutely, yes.
You know, I can never say the word, but mesothelioma, did I say it right?
Yes, you did.
Okay, you see those ads all the time, so I would suspect this might be something good for folks that are working in industrial settings where there might be fumes or whatever. I mean, there's just, garages. I'm making things up. I don't even know. That's beyond my realm here, but anybody that has any concern with lung things, they probably would be eligible for this?
Yeah, I think anybody with concerns should call the hospital. We'll connect you with the 1-800 number that will do the actual screening and determine if you're in need of a study. And I think, you mentioned your friend, early detection is the key to many cancers. Right. So lung cancer, breast cancer, colorectal cancer, we have screening tools that allow us to detect these things early. So I always hate to hear when somebody dies from something that potentially could have been preventable because we have great screening tools in place today to catch things early.
Well, that's great to know. Yeah, and I suspect that if anybody that's in that scenario that you said over 50, exposed to family smoking and smoked yourself, probably should get checked out. Right?
Absolutely.
All right, that's good to know. You mentioned something about the ER looking different. In what way?
So there was a complete redesign to the flow of patients in the emergency room. We actually, before I returned to Westfield, they did a complete renovation of the ER. All the equipment is new. They've redefined the walls and the flow of patients, so patients actually flow through the ER quicker and easier. We're able to bring them right back into a triage room in many cases, so they're not waiting in the waiting room.
Oh, the eternal abyss. You
Yes.
just sit there forever, it seems. So what you're saying is basically, there's a pretty quick turnaround there?
There's a pretty quick turnaround, and we're pleased to say both between the new flow of the ER, the new equipment that we have, and the providers that we have at the ER, our door-to-physician time is on average 18 minutes. So from the time you walk into the Westfield Memorial Hospital emergency room,
18 minutes?
our average time to see a physician is 18 minutes
That's half
or less.
a TV show.
Yes.
By the time somebody started watching this show, if they had started in when I first said the first word, they already, by now, according to my record, they would have well been treated by now.
Absolutely, and so our goal is for them to come in the door, be moved into this split flow triage area. Typically, our goal would be to have them see a nurse in 5 minutes or less, and then to see a physician. The national standard is to see a physician in 30 minutes or less, and we're well under that national
Holy
average.
moly, I guess so. Well, that's terrific, because, I'm not going to cite any other facilities, but that is never, it's usually in the form of hours rather than minutes. And I've actually heard, I understand, if you've got a situation where you're backed up because of some horrible tragedy, you're going to have it backed up. But I've heard just typically you go to some larger facility and you might be waiting an hour or two still in the waiting area, or I don't want to say this, but maybe on a gurney in a hallway waiting or whatever. So, it sounds like Westfield is kind of got the best of both worlds, small but yet can be very responsive to the situation. And
Yes, we are high tech and high touch.
high touch. Okay, so we talked about the new ER, but now my understanding is that you've got two organizations there that are committed and dedicated to helping the hospital. Did you want to speak to those boards at all?
Sure, I would love to. We are grateful to have both the Westfield Memorial Hospital Foundation, who year over year gives hundreds of thousands of dollars to the facility for us to use in expanding programs and services at the hospital. And they're in the midst of their annual campaign now. So if you'd like to donate, certainly call the hospital and we could connect you with the foundation. Right now they're raising funds to increase the lab equipment, to replace some of the lab equipment that we have in our laboratory today, as well as some additional equipment for physical therapy.
Is it common for a hospital to have a foundation to do that?
Many hospitals do have foundations, but what I'm most impressed about is, given the size of our community and the hospital, the amount of funds that the foundation have been able to raise, both through their annual campaign and their summer golf outing, have been just tremendous. So it speaks to the effort of the foundation board, as well as the support from the community at large for our hospital.
I know we do a lot of announcing of various fundraisers for them throughout the year, and that's great to hear. So really what they are doing is they are encouraging people out there to pool their money, and then it goes right into the hospital, right?
It goes right into the hospital, yes.
That's wonderful. So that was one. You said there was two?
Yes, the second one is the Ladies Auxiliary. They have been supporting the hospital for probably more than 30 years. I don't have the exact number.
Well, the hospital's over 75 years, so they've been a good long time.
So they've been there a good long time, and we're grateful for them. They have every year at the annual Crust Festival, they do a huge pie sale, and they come into the hospital and bake these wonderful pies that smell up the hospital, and we're buying them while they're coming out of the oven. But they also had last Monday, they had their chicken and biscuit dinner to support the hospital. There's mug sales, ornament sales, quilt sales. So those ladies have worked tirelessly to raise funds for the hospital, and many of their funds go to facelift for the hospital. New blinds, they've redone the lobby at the hospital. They've redone the emergency department lobby. Fresh coats of paint, new chairs for our patients to sit in, window coverings. They outfitted a huge hospice room in our hospital for us. So they've really done a great job at making the hospital look nice for our patients and for our staff.
When I've walked through that hospital from time to time, yeah, it's almost like, come on in, this is your living room kind of a feel. It's very, very homey, very comfortable. The colors are very inviting. It's like, if it was comfort food, if it was food, it'd be comfort food.
Absolutely.
And again, I'm not trying to diss any other organization or hospital, but I just know over the years I've gone into places where you get this feel like this institutional green or blues in parts of the hospital, or clinic or wherever. Other parts are beautiful and lots of glass and things like that, and that's cool. But Westfield has its own feel to it, doesn't it? It's very, very unique to the area, and I know there's some history in the front foyer of the hospital. It goes back to when they first started and all that. So great organization for many, many years. Okay, so we talked about the past, we talked about the present, and some of the things that you've seen differently since you've been back. So, Karen Surkala, as president, what are you going to drive in the next several years? Or many years, I don't know how long you want to do this.
So what I would some of the things that are on the forefront would be, again, expanding our inpatient services and looking at ways that we can keep more patients here in the local community. Another project that we're working on is telemedicine. So it's bringing the specialists from Pittsburgh via communications technology to the bedside of the patient here at Westfield Memorial Hospital. So we're working on a pilot project right now, and we hope to, right after the first of the year, probably within the first quarter of 2020, be able to offer various medical services where the physician doesn't have to actually lay their hands on the patient, but just like a video screen or a Facebook chat, FaceTime chat on your iPhone.
Well, it's basically what we're doing right now. We're streaming live. It'd be almost the same thing, right?
Yes. So we want to be able to offer those services, and some of the services that we're looking at are things like endocrinology, rheumatology, and dermatology, which are difficult to access even in the largest of cities. So we are excited about being able to bring that to Westfield Memorial Hospital and to the patients who live here in the community, so they're not driving an hour and a half into Buffalo or 2 or 3 hours to Pittsburgh or Cleveland to see these specialty services.
I hear a dog barking. Did you hear a dog barking?
I did hear that.
So we must have a caller. So good morning, caller.
Oh, good morning. This is Linda. How
Hi,
are you?
Good.
Good morning, Doc. Good morning, Karen. Karen, it's so great to see you on the show, and I am so appreciative that we still have our Westfield Hospital.
You bet.
We're very grateful for the wonderful services that you give us. And I know it's late, so I won't talk long, but there are services for employment and other services for health insurance counseling, which is free at the Chautauqua County Office for the Aging. The number is 753-4471. And happy Veterans Day, and thank you to all of our veterans.
Now, don't go too quick now. So the insurance obviously plays a huge role in what we're talking about today. So what does your agency have to do with that?
Well, they give free counseling. They give you the options, especially if you are already receiving Medicare, the alternates. There's Medicare Advantage programs. There's supplementary or wraparound insurance companies. There's prescription coverages, all of that. They just present options that are there, all of your options.
People could find out that they could get better coverage and better benefits for less money.
Right. They make their own decision, and it's case by case. Every situation is different.
Okay. And with your job placement, have you had an opportunity or need to place anybody at the hospital?
We haven't placed anybody there, but it would be great to do that.
This is my shtick. I do the sideline here.
Well, Doc Doc is our job developer. I have terrific people in our program, and they're committed, they're dedicated, they're dependable.
Okay.
You can always count on them to get the job done.
Okay, Lynn. All right, well, thanks for calling in, and
Great, thank you so much. And you know, she mentioned the insurance services. It's very difficult for the elderly to weed through all of the promotional
you
materials
don't
that
have to be
they
old
get.
to do it.
Well, you're right. So I think the service that they offer is tremendous
Yeah, it is.
for
Yeah.
for seniors because they're just inundated with pamphlets and mailings.
I noticed that lately. Yeah.
It's that time of year.
Okay, Lynn. Well, take care and have a good weekend. Eh?
You too. Thank you. Bye-bye.
Okay. You know, Lynn mentioned it's going to be Veterans Day on Monday. Veterans obviously have a lot of good insurance. Do you work with the VA and so forth at Westfield?
Absolutely. We take all of the government insurances, both here and then across the Allegheny Health
So
Network.
all the way through. So if you're a veteran, you're good to go there?
Yes.
Okay. So you talked about telemedicine. So let's say let's pick a topic here. Endocrinology. So what is that, and how does it work with telemedicine?
So typically, people with diabetes
Oh.
need to see an endocrinologist
Okay, so
to
that's-
help manage their medication and their A1C levels.
All right. So it's not like something they gotta look into their body. It's check their levels or ask them how if their feet are giving trouble, or there's certain things they could just see visually, right?
Yes, it's really just having a conversation and maybe seeing something visually over the television screen and the camera.
So who's on the other end?
So it will be physicians from Allegheny Health Network. It may be a physician that sits in Erie, and we can save folks a trip to Erie, or it could also be a physician that's sitting at Allegheny General or one of the other Pittsburgh hospitals. So it's bringing the high level of care
Somebody's a
right here
specialty
in the
area.
community.
All right, so let's just say I walked in there and I was the patient. So would I just walk into an empty room and have to turn on a button, or how's that all work?
Now, we'll have staff that would support you.
Super.
So there'll be a staff member there. They may take vitals for the provider who's on the other end.
okay.
There would be a staff member in the room with you the entire time to answer any questions or assist with anything the provider on the other end might need.
That sounds really awesome. And again, saving time, energy, resources, and work loss, all that sort of thing. Karen Surkala, the president of Westfield Memorial Hospital, we're down to 1 minute and 48 seconds here. So what would you like to talk about? I'll let you share whatever you want right now.
Well, thank you so much. I appreciate
absolutely.
the opportunity to be here and to talk about Westfield Memorial Hospital. It's a great place. We have really dedicated providers. We have a very supportive community and really a full range of services for a community this size. Our infusion program grows year over year. Our lab and imaging program, they're just taking off. And we're really focusing on building our cardiac rehab program and looking at expanding that for patients who have cardiac disease and need to exercise with medical supervision. So watch for more to come on that over the next few months.
And that's through your physical therapy department?
It's located in the physical therapy department, yes.
Okay, and you mentioned the word infusion. Here goes the 6-year-old again. What's infusion mean?
So it may be patients that need drugs, certain medications that take a longer period of time. It's more than just an injection. Maybe it takes an hour
Is this like a,
for the
like
drug
drip
to enter.
type bag with a cord or hose or?
Yes, absolutely.
I'm making this up as I go here.
There's some shots, we just expanded our women's program at Westfield, and OBGYN associates out of Erie are renting space from us and offering services.
Is that currently?
That started in September, and they're there 2 days a week. So we have new ROGAM shots for our pregnant moms that they get in the infusion center at Westfield.
Terrific.
But the expansion of OBGYN services has been a huge uptick for the hospital and really for the patients in this community who need that service.
So women's services, infusion, telemedicine. Wow, a lot going on there.
There is indeed.
All right. Well, I think we're running low on time. I guessed it. So Karen Surkala, thanks for joining me. We'll have to have you come back and give us updates from time to time.
I would love to. Thanks so much.
You're welcome. I'm Doc Hamels, and you've been watching Chautauqua Sunrise. You can catch us on YouTube any old time once it's posted. And remember, we're on at 2 and 8 every week on channel 1301 And good afternoon, and have a wonderful week for my listeners on WRFA 107.9 Low Power of the People. We'll see you again next week, but also remember, thank a veteran out there when you see them for their service. Couldn't have this country as it is without them. So salute to you, and have a great Veterans Day weekend. Bye now.